We've all heard it in movies, right? That flatline sound from a hospital monitor. Well, in that exact moment, a clock starts. A life is literally on the line, and guess who becomes the most important person in that room? The nurse. So today, we're going to walk through what happens next, from the very first sign that something's wrong, all the way through resuscitation and what comes after. Let's get right into it.
So when a heart stops, it's not just another emergency. It is, no exaggeration, a full-on race against time. I mean, every single second that passes is critical for survival, and not just survival, but for a good, meaningful recovery. Time is, quite literally, everything.
So who's right there at the starting line of that race? Well, it's the nurse. You see, their job isn't just about providing routine care. They are constantly on alert, looking for trouble before it even happens. It's their sharp assessment, their critical thinking, that can be the difference between a patient having a minor scare and a full-blown cardiac arrest.
Okay, so let's start with a term you've probably heard, code blue. When that call goes out over the hospital speakers, it's an unmistakable all-hands-on-deck signal. It means someone's heart has stopped, a life is hanging in the balance, and a highly skilled team needs to get to that bedside now.
So, we're diving into recognizing the science. But really, how does the nurse catch a crisis before it explodes? Well, it's all about being a vigilant sentinel. It comes down to two key things: surveillance and prevention. I mean, you can think of the nurse as a watchtower, always scanning, always looking for those tiny, subtle clues that something just isn't right. And they have a powerful tool to do this, kind of like a secret weapon. It's called the ABCD approach. Now, this isn't some rigid checklist. No, it's a really smart, systematic way to quickly assess a patient and figure out what is going wrong and, more importantly, how to start fixing it, all in real time.
Okay, so that's prevention. But what happens when, despite everything, a patient's heart stops? Well, the nurse's role completely shifts in a split second. They go from being the sentinel to being the first responder. And at this point, every single action they take is absolutely critical.
You know, in the middle of that chaos, it's so easy to freeze up or get overwhelmed. That's why the 3 C's are so effective. They're a simple, powerful way to cut through all that noise and focus on what matters. It's call, CPR, crash cart. That's it. Call for help, start compressions, and get that cart. There's no time to hesitate. It's all about immediate, decisive action.
Okay, let's be real about CPR for a second. Not all CPR is created equal. There's just doing CPR, and then there's doing high-quality CPR, and that's what makes the difference. We're talking about the details, right? The right rate, 100 to 120 compressions a minute, the right depth, at least 2 inches, letting that chest fully recoil, and maybe the most important thing, minimizing interruptions. Every pause matters.
All right, so the Code Blue team arrives. Now what? Well, the nurse's role evolves once again. Suddenly, they're not just the first responder, they become the orchestrator. It's like they're conducting a symphony where every note, every instrument has to be perfectly timed to save a life.
And if you look at how it's structured, it's actually fascinating. Just like an orchestra, everyone has a very specific part to play. You've got someone on compressions, someone managing the airway, another nurse handling medications, and someone whose only job is to record everything. And let's not forget the patient's own nurse. They're absolutely essential for providing that critical patient history. It's all designed to work like a well-oiled machine, turning chaos into coordinated action.
Now think about it. In a high-stakes, noisy environment, how do you make sure nothing gets missed? It's so easy for messages to get garbled. Well, high-performing teams use this incredibly simple but brilliant technique called closed-loop communication. It's really just like when you're at a coffee shop and the barista repeats your order back to you. Why? To confirm they heard it correctly. It's that same principle, but here it literally prevents life-threatening mistakes.
And here's a perfect example of what that sounds like. The team leader might say, giving 1 milligram of epinephrine now. The medication nurse doesn't just nod, they respond. Confirmed. 1 milligram of epinephrine is given. Boom. It's a simple check and balance, a verbal handshake that ensures everyone knows exactly what's happening, when it's happening.
And you know, it's not just about communication, it's also about choreography. The physical layout of the team around the bed is completely intentional. They form this tight, efficient circle, kind of like a pit crew in a car race. Everyone has their spot, everyone has their job, and it allows them to work seamlessly without getting in each other's way. The goal is maximum efficiency when every second counts.
Okay, so we've got high-quality CPR going, and the team is working together like a well-oiled machine.
But that's just step one. Now we get into the advanced stuff, the protocols designed to actually restart the heart. This is where the clinical expertise really shine.
All right, so the very first big decision point for the advanced team is figuring out the heart's rhythm. Basically, they're asking, is this a shockable rhythm? Is it something where an electrical shock could work, kind of like hitting a reset button on a computer? Or is it a non-shockable rhythm, where a shock won't help and the focus has to stay on amazing CPR and giving the right drugs? That one piece of information dictates the entire course of treatment.
So, when a shock is needed, the AED or defibrillator is pretty smart. It guides the team through the steps. Analyzing rhythm, shock advised, clear. But here's the thing the machine can't do. The moment that shock is delivered, someone has to get right back on the chest. That immediate return to CPR is absolutely crucial to keep blood moving to the brain.
Now, getting a pulse back, that is a massive win. But here's the thing. The emergency isn't over. Not by a long shot. In fact, a whole new, incredibly delicate phase of care is just starting. And once again, it's the nurse who leads the way on this road to recovery.
The term you'll hear is ROSC, R-O-S-C. It stands for Return of Spontaneous Circulation. And while it's a huge moment of relief, it's also a trigger. It signals an immediate pivot in care. The focus instantly shifts from restarting the heart to protecting the brain and other vital organs from the damage that just occurred.
So, what are those first priorities after ROSC? It's all about stabilizing. First, secure the airway and dial in their oxygen levels perfectly. Second, get their blood pressure stable, making sure enough blood is getting to the brain. And third, assess their neurological status. It's a delicate balancing act, and the nurse is at the center of it all, fine-tuning everything to give that brain the best possible environment for healing.
Okay, so the immediate crisis is managed, but the work isn't done. The final piece of this whole process is maybe the most important for the future. It's about looking back, learning, and making sure the system is always improving. So, the code is over. The team has done everything they can. The patient is transferred to the ICU. What happens now? It's a simple question, right? But the answer is what separates good teams from great ones. It's what ensures that we're better prepared for the next time this happens.
What should happen is a post-code debrief. And let's be super clear. This is not about blame. It's not about pointing fingers. It's a structured conversation to look at the timeline, to celebrate what went right, and to identify areas where the team or the system can improve. And, just as crucial, it's a space for the team to process a really intense event and support each other.
When you really step back and look at it, the modern nurse is so much more than just a caregiver performing tasks. They're the sentinel, the first responder, the team orchestrator, the post-arrest expert. They are the constant, essential thread that runs through every single link in the chain of survival. They manage this incredibly complex system, not just to save a life, but to help restore it.